Hi, welcome back to Aqua Platycodon, where more useless knowledge gets unlocked. Today we're diving into a thought-provoking topic, the stark difference between the healthcare systems of Canada and the United States. Why does a CT scan cost around $495 in Canada, but often much more in the United States? Let's break it down and explore what this means for fairness, efficiency, and the lives of ordinary people. Let's start with Canada. Here, healthcare operates on a universal model. Every Canadian citizen and permanent resident is covered by public health insurance, meaning most essential medical services are free at the point of use. A CT scan in a public hospital typically costs the government around $495, not the patient. This transparency ensures that everyone has access to necessary care, regardless of income. Sure, you might face longer waiting times for non-urgent services, but the trade-off is fairness and equality. Now, let's look at the US. The healthcare system there is largely market-driven, which leads to much higher costs. While the average cost of a CT scan is around $1,000 to $3,000, reports indicate that in certain cases the price can climb as high as $9,000. Why? The reasons include administrative overhead, private profit motives, and opaque pricing systems. Hospitals in the US often operate as businesses aiming to maximize revenue. For many Americans, this creates a harsh reality. Imagine working multiple jobs, yet being unable to afford basic health care. For countless families, even a routine medical checkup can lead to crushing debt. Many must choose between paying for medication and covering their rent. Stories of people rationing insulin or avoiding emergency rooms out of fear of the bill are far too common. So how do these differences affect the average person? In Canada, the focus is on preventive care and universal access. Everyone gets a baseline level of care, which contributes to better overall health outcomes, like lower infant mortality rates and longer life expectancy. In contrast, the US system is highly polarized. The wealthy enjoy exceptional care, while the poor often face financial ruin due to medical bills. And in those rare but extreme cases where a CT scan costs $9,000, the financial consequences for a patient without insurance could be catastrophic, potentially plunging them into long-term debt. This disparity raises an important question. Should healthcare be a public service or a commodity? Canada's system shows that prioritizing fairness and accessibility leads to better societal outcomes. Meanwhile, the US approach highlights the challenges of market-driven healthcare, where profits can overshadow people's well-being. To wrap up, the difference between these two systems isn't just about money, it's about values. Do we value equality and shared responsibility, or do we prioritize individual choice and profit? Let me know your thoughts in the comments below. Thanks for watching Aqua Platycodon, where more useless knowledge gets unlocked. Don't forget to like, share, and subscribe. See you next time.